Well, I'm really pleased to introduce our luncheon speaker to you. Dr. Cheryl Hilton is the Dean of the NYU College of Global Public Health. She's responsible for building the College of Global Public Health's academic service and research programs, which focus on domestic and international health with an emphasis on prevention, systems intervention, and innovation in the public health practice. Pertinent to this conference, previously she was the founding president and CEO of Legacy, a leading organization dedicated to tobacco control. And she worked there to further the foundation's mission to build a world where young people reject tobacco and anyone can quit. She launched a national smoking cessation campaign, public education campaigns, etc. Additionally, Legacy established the Steven Schroeder Institute for Tobacco Studies. Prior to Legacy, she was at Columbia, where she worked to expand the scope of public health programs and undertook innovative educational initiatives to advance public health practice. We really get a twofer here with Cheryl, because not only is she truly a public health expert, but she's also very interested in the mechanisms that bring opportunity out of legal issues to improve public health outcomes. She's written on this topic and happens to be the head of the public health school here at NYU. How much better could this be? Cheryl, thank you.
Thank you very much, David. I'm happy to be here and nice to be here with all of you talking about this important subject. In a sense, right now we're sort of going to go to College of Global Public Health 101. And really, I want to talk about how important the legal profession and attorneys general are to improving the health of people, not only here in the United States, but around the world. I won't get into around the world because I'm focusing on the United States today, but I have given some thought to the other major public health problems. And more we're using a term called the corporate determinants of health. They can go either way, but of course, I'm sure many of you know that with respect to some products, the corporate determinants of health are indeed quite negative. And therein lies the rub, and therein is the opportunity for a legal intervention of one sort or another. I had some help in my thinking about this, and you may recognize some of these people. Steve Schroeder, the former president of the Robert Wood Johnson Foundation and one of my bosses at Legacy, now Truth Initiative, when he was on the board. Doug Blanke, who is the head of the Public Health Law Center. Tom Miller, who's a sitting AG, and they've got the wrong state there. He is with Idaho. So that's a big typo. He'd love that. And Iowa, I'm sorry, I meant Iowa, forgive me. And Bill, so I just got my eyes in one bucket there. And Bill Sorrell, the former AG of Vermont. And Sandro Galea, at whose school I first presented the basic concepts here. And as I was presenting this talk, which is about the applicability of the tobacco settlement to other major public health problems, the tragedy in Parkland, Florida, unfolded. In fact, it was obvious to me something was happening, and someone handed me a note to let me know what was happening. So I've created a little hierarchy here for you. These diseases that are up here, or risk factors, some are one and some are the other, but principally they're risk factors, and the number of deaths per year. And it's kind of startling. Let's begin at the top. Firearms, 39,000, the majority being suicide. Death by suicide is rising among women using firearms. There's a reason for it. The NRA has hit on them, and the gun industry in particular, as the new big market. Opioids, I don't need to tell this audience that we have a raging epidemic on our hands, and now multiple efforts underway to try to seek criminal litigation, potentially civil, potentially various settlements that might look not unlike the tobacco settlement. Alcohol-related deaths, which actually have been falling in the United States, but rising in some subgroups, most notably younger women who are getting cirrhosis of the liver for the first time. Obesity, which remains a major risk factor. I'm using the low-end estimate there for obesity. Others say it's 300,000 deaths a year. And the bottom line, tobacco, we know, 480,000. 1 billion will die this century. 100 million died last century. So a tenfold increase century over century in really 100% preventable death due to a product that I would say arguably from a public health perspective, doesn't belong on the market. If it was invented tomorrow, it would never come to market. It would be illegal under the consumer protection laws of all states and all countries. So that's 33% roughly of all deaths every year related to these major industries. So we talked a little bit earlier about what the MSA was about, and I just very briefly here summarize some of the same information, so I won't belabor it. But I will say that the settlement did create the Legacy Foundation. It funded it with about $1.7 billion over a 10-year period. Those payments had a sunset clause built into the agreement. And just to add a twist, because it's relevant to what you heard earlier today, those payments actually came from the 46 states. And I was reminded on a few occasions, including when we were in protracted litigation with Lorillard Tobacco for over 7 years, that the states could choose to sever those payments had they wanted to. No state ever did attempt to sever them. So then, imagine what an MSA could do. So it could increase the cost of the product. You heard that earlier. It had an enormous effect on tobacco. Increasing the price of certain types of products can suppress its use very rapidly. And of course, an industry who has to make a major settlement like this is delighted to be able to pass those costs on to consumers. An MSA can mandate the use of funds by the states, but they have to be very careful how they do it. That was discussed a little bit earlier. The example I'm most familiar with is the public education campaign for the state of Florida, which was one of the 4 states that settled in advance of the 46-state settlement, actually said that they would release the funds in the settlement at such time as the state appropriated the funds. So if the state never appropriated the funds, then those funds would never be released. So that's certainly one way it can happen. Probably one of the most important things an MSA can do that you heard about earlier today and is very relevant to all of the problems I discussed a moment ago is that they can get concessions from an industry that cannot be legislated, particularly because of the application of the First Amendment to corporate speech issues, both on the side of forced speech as well as speaking against oneself. So it is most important that we're aware of that, and it's relevant for all, but it's particularly relevant for guns. I'm going to use just 2 examples because we don't have time to use all the examples that are up there. I'm going to use the one I'll call the impossible dream. I'm sure everyone in this room is aware of the 2005 passage of the Protection of Lawful Commerce of Arms Act, which essentially, in essence, indemnified the gun industry against litigation. At the time that that was passed, in the same year, the federal ban on assault weapons was allowed to expire. There was, and I don't have time to review it all, nor would I do it justice because I'm not a lawyer, there was a lot of AG activity around guns, and there was a lot of local activity around guns. And the passage of this was the ultimate and federal preemption to forestall any of those efforts, and it has been quite successful in doing so. One of the reasons it is successful is there is a gap between the views of Republicans and Democrats on issues of guns. I'm just picking a few here. The Democrats are in blue, the Republicans are in red. They're in basic agreement on the first 2, preventing the mentally ill from purchasing guns, banning gun purchase by people on no-fly lists. They are not in agreement on allowing conceal and carry in more places, and they're not in agreement on teachers carrying guns to school. So why is it that they're in disagreement? Well, a lot of it is political, but a lot of it is also the media they watch, and we'll get to that in a minute. Who is informing them about the public health facts around guns? And let me please tell you right off the bat, absolutely no one is adequately informing the American public about the facts about guns, and the results are absolutely tragic, and many of them entirely preventable. This is another sad story. The percent of Americans that favor a ban on handguns, has been going in the wrong direction until just recently when the 2 lines reversed. The light green is the percent who said that there should be a ban. The darker green are those that say there should not be. And just recently have we seen a change in views. And that change in views, I understand from people involved in the polling, is more bipartisan than ever, which is a good sign. Again on guns, death by guns is rising. It's rising for homicides and it's rising for suicides. One of the primary reasons that it's rising for suicides is because more women are attempting to kill themselves with a gun. Guns are the most efficient way to kill yourself. There is, to my knowledge, only one state, and this just happened, that provides any information to consumers who are buying a gun about the probability of the gun being used by themselves or someone in their family to kill themselves or to kill another member of the family, which is the two most probable scenarios for the use of a gun in the home. It's the best kept public health secret in the United States of America, and there's a three-letter reason why. It's the NRA. Let's play an ad from the NRA. This is their most popular ad. I think, assuming most of you are from the Northeast, you'll find this a fairly disturbing short ad. This is what the American public is hearing.
They use their media to assassinate real news. They use their schools to teach children that their president is another Hitler. They use their movie stars and singers and comedy shows and award shows to repeat their narrative over and over again. And then they use their ex-president to endorse the resistance, all to make them march, make them protest, make them scream racism and sexism and xenophobia and homophobia, to smash windows, burn cars, shut down interstates and airports, bully and terrorize the law-abiding, until the only option left is for the police to do their jobs and stop the madness. And when that happens, they'll use it as an excuse for their outrage. The only way we stop this, the only way we save our country and our freedom, is to fight this violence of lies with the clenched fist of truth. I'm the National Rifle Association of America, and I'm freedom's safest place.
A little chilling for everyone in the room? I find it very chilling, to say the least. I guess we're gonna, in a minute we'll move on, but the next thing I wanted you to briefly see is something some of you may have seen, but I think it speaks to the problem. I started out by saying the AGs in the law enforcement community and lawyers themselves are the greatest, best hope to help stop people from dying unnecessarily due to products, because they are ill-informed about what the products will do to them for a variety of reasons, including ones that are probably very illegal. And I picked my impossible dream of guns, knowing that the current federal preemption will not allow anything particularly meaningful to happen. And the other one I'm using in one moment is opioids. So you may have seen this. Anybody here, who has seen this from Baron Cohen? Okay, so 90% of the young people in the United States of America have seen this. Thank goodness, because this is the answer to the ad that we just saw. Known as earned media.
I was welcomed into the halls of Congress, where I sat down with the House representative and outlined my common sense proposal.
Oh, you want me to say on television that I support 3- and 4-year-olds with firearms? Is that what you're asking me to do?
Yes. You can do
Typically, members of Congress don't just hear a story about a program and then indicate whether they support it or not.
I support the kindergartens program. We in America would be wise to implement it too. It's something that we should think about in America, about putting guns in the hands of law-abiding citizens, good guys, whether they be teachers or whether they actually be talented children or highly trained preschoolers.
Maybe having young people trained and understand how to defend themselves in their school might actually make us safer here.
A 3-year-old cannot defend itself from an assault rifle by throwing a Hello Kitty pencil case at it. Our founding fathers did not put an age limit.
I just want to say
Okay, so that's really comforting, right?
I was
Okay, so if you think it's just that they're putting insane ads on the web, like the one we just saw from the NRA, They have a partner. Now, this is actually the good guys, the Violence Policy Center. But the truth about guns, is an absconded steal of the Truth campaign from Legacy. And if you notice the spokesperson from the NRA, using the word truth, I'm bringing you truth, they know who their metric is and they know where they're losing. They're losing ground with young people and they want to regain ground. And so they're using many of the things that are from the traditional playbook of the tobacco industry. I'm not showing you all of the visuals, but some of them are mind-boggling, including real miniature purchasable assault weapons in pink, shocking pink. If you want to get your kids into guns, you can keep them away from drugs. California, as I mentioned earlier, has just required warning labels for gun sales. It is very likely to be adjudicated. I'm sure there are people in the room who know what might happen with that. It will probably be not unlike what happened with this. The state of Florida, as I think you all know, literally passed a law that no pediatrician could discuss with any family or any parent or any child the risks associated with using a gun, handling a gun, keeping a gun in the home. And that was enforceable there for a number of years until it was recently overturned. And I believe it was overturned at the state level, if someone can correct me if it was federal. Okay, so we've covered one problem, guns, the impossible dream, but I believe I'll live to see an MSA related to guns. Now, I am planning on living to be over 100, so that gives you a few more years. Everyone has heard about what's happening with opioids, and as we all know, a lot of activity is going on in opioids. Many of the sessions at the NAG meeting that just happened recently were closed sessions around how to manage the various issues that are happening with opioids. I just want to give you a quick Public Health 101 in opioids. Picture says 1,000 words. This is what's happening. It is now an epidemic equivalent to the AIDS epidemic at its height in the United States of America. This is precisely the number of lives that were being lost at the height of the AIDS epidemic. This is what the frequency of being admitted for an opioid problem was in 1999. Note that dark brown state, how few states had 45 or more people admitted for an opioid incident. They could be admitted dead, to be honest with you, but most of them were admitted in having a problem with opioids that could be reversed. And this is what it looks like in 2009. And then look at these lines. The top line is, the green line is opioid sales in the United States of America. Look what happened to them since 1999. Opioid deaths is the red line, and opioid treatment is the blue line. And the red line at the bottom is Europe. We are the green line. And so that line at the bottom is pretty much the global line or less than that. So we are the absolute global, worldwide epicenter of the opioid epidemic. There is actually a paper that came out in Science that is being liberally used by people in the opioid industry describing this pattern that we see as a natural exponential pattern that would have happened in any event because X% of people coast to coast will always be drug seekers, and instead of seeking drug ABC, they just happen to seek drug Y. Why? Because, of course, the opioid manufacturers and their partners are really squirming about what might come for them. How did they manage their communications? And if there was ever an industry that is ideal for the kinds of restrictions that the tobacco industry was put under with respect to, as you say, front groups. I put front groups in the New England Journal of Medicine and they edited it out. They said, Cheryl, find a word other than front groups. We don't want to be sued. So I found a different word, but I love front groups. So they have a lot of front groups. In fact, in a moment, I'll explain to you that they turned JCHO, which is the entity that accredits hospitals coast to coast, into their partner. But the physicians are needlessly allowing patients to suffer. Opioid addiction is rare in pain patients. It's 50% if you use them for more than 2 weeks. 50% become addicted. So I would not call that rare. Opioids can be easily discontinued. That's a total falsehood. Opioids are safe and effective for chronic pain. Not only are they not safe and effective, they are known at this point not to be effective, and they certainly are not safe. Then we don't have enough vital signs in the hospital. It is the opioid industry that successfully lobbied for and created pain as the 5th vital sign. And I remember when my son first got to his first rotation, the introduction to the patient phase of medical school, he said to me, came home and he said, Mom, what is it with this vital sign for pain? Everyone's begging for drugs in the hospital because they have a little tiny pain. The only way we know if they're uncomfortable is if they can describe their pain to us and where it is. I don't want to give these people opioids. And I said, well, don't, give them 3 Tylenol and 5 hours later give them 3 more Tylenol. The vast majority of people who are given opioids for pain do not need them. Your children do not need to be sent home from the dentist with 2 weeks of opioids, nor should there should be a law against that. And then here's the conclusion of one of the largest studies that looked at all the literature. Read only what is in the yellow. It essentially says that there is no evidence that long-term use of opioids to control chronic pain is helpful. So now, this will be the fun part. Why an attorney general won't sue to try to settle with an industry. So this is happening as we speak. There's not a strong case against the industry with proof of legal violations, so negotiations would be difficult, if not impossible. That would be sort of true of the gun industry right now. The industry is important to their state, jobs and votes. And when I circulated this paper to my AG friends, a few of them called me up and said, do you really want to say that, Cheryl? Is it really true? And they said, yeah, it's true, but do you really want to say it? I said, I think we need to say it. They receive campaign funds directly or indirectly related to the industry. Philip Morris, as some of you may know, used to own Miller Beer and Kraft Foods. Therefore, they had what they called in their once secret, now not secret documents, a beachhead strategy. Their beachhead strategy was to have economic activity in every state, preferably in every county. It's not about children. If it's not about children, it's harder for AGs to jump in and act because they perceive that adults who vote for them are not fans of the nanny state. I like to think of it as Mother Earth, but I'm a fan of Mother Earth, but I'm not really a fan of a nanny state. So often these issues are couched in terms of children, and it's pretty easy to do and to get a long way by staying on that terra firma of the case about children. Certainly guns is a case about children. The highest suicidal ideation in the United States is among adolescents. If you put a gun in their home, you quadruple the possibility that they will die successfully in a suicide attempt. They're afraid that if they do successfully go up against an industry and begin a legitimate effort to try to create either a settlement or litigate against them for various reasons, that they will, what will happen to them will be what happened during the tobacco wars, when if you came out against the tobacco industry, they poured money into an alternative candidate and they made certain, absolutely certain, that you would be out of office. It's also expensive to pursue. Our colleagues here from NAG will know more about just how expensive, but it is difficult, and only a handful of states really have the wherewithal to be able to pursue a very expensive a state. And then what happens when you do pass one? How can an industry fight it? They can sue for failure to enforce the MSA. I think that's happening right now with tobacco. They can sue a collateral organization, Legacy. We were in litigation for over 7 years with the tobacco industry trying to shut us down. They were trying to shut us down because we made unflattering ads about them. I'm only going to show you one in a couple of minutes. They did not care for those unflattering ads. We made a statement in the ad that they added urea to cigarettes. They do add urea to cigarettes. Tobacco also naturally has urea. Urea functions to open the airway and addict people earlier. The act of adding more of it is really bioengineering for addiction. It took someone on our staff about 4 years, but she found the email, which is framed in my office, in which the CEO wrote to the engineering and said, "Is it true that we add urea to our product?" And his response was, "From time to time, we have to fertilize." That was the answer. So they can argue changed circumstances. They can harass individuals associated personally and through the press. And many of you who have seen The Insider know how harassed one individual was, and the fact that he was not successfully prosecuted for violating his non-disclosure agreement with RJR is, I understand, thanks to Mike Moore. Someone can correct me if that's not the case. And they can exploit poorly written provisions in the agreement. So you do not have to This is a very busy slide. The only interesting thing is to look at is the title, the domain, and then the industry. So this one is just, what could you do in firearms if you patterned it pretty much after the Tobacco MSA and you didn't have the Lawful Commerce of Arms Act and actually some equivalents now popping up in the states at the state level? Well, first of all, you need a science base. The science base is there on firearms. There are at least 10 legitimate things that all consumers should be warned about if they're buying a firearm. The compensation to public and private sector. There are extreme costs to the healthcare system and other costs associated with what happens with firearms. Las Vegas, 54 people died in one or 2 hours. 54 Americans shoot themselves successfully by suicide every day. So every day is a Las Vegas. It's called Depressed Americans with a Gun. None of them are told, are you on medication? Have you ever been on medication? Nor are people given the opportunity to put themselves on a no-buy list, which is really a good idea, because about 95% of depressed people, if you caught them in a moment when they weren't depressed and said, how about we put you on a no-buy list, would probably agree. So there are many things you can do, including labeling and warnings. Again, repeating what we heard earlier. You cannot get these legislatively, but you can get them within agreements. And there are very important issues around advertising restrictions and warning and labeling that should happen. The lobbying and advocacy groups are extremely crucial. They are lining the pockets of most of the people in the state and federal legislature one way or the other, and it is being reflected in the kinds of policies that are passed. And if we don't find a way to shut them down, as we did with the tobacco industry, they will continue to have that effect. I'm not going to go through all of these. This is what it would be if it was sugar-sweetened beverages and fast food. If you're interested, go to the Truth Initiative UCSF documents. They are now tracking the sugar papers, which are a treasure trove of papers about how the sugar industry, with malice of forethought, created a series of studies to discredit anyone that said sugar was a health problem and shift their focus from sugar to fat. And in fact, it turns out that sugar is indeed not only a culprit, but in many respects, the culprit with respect to key health concerns such as diabetes, obesity, et cetera. I won't go through all of them. Opioids, this is what's happening now. All of this is in the New England Journal of Medicine paper from a few months ago, just my name, and you can pull up the whole thing. And I did a column for every industry. So the column for the opioid industry really tracks what was in the tobacco settlement, and it includes, very importantly, a mass media public education campaign, not unlike the highly acclaimed and highly successful Truth campaign that was created and launched by the Legacy Foundation, now known as the Truth Initiative. Same for alcohol. Alcohol is the analogies between alcohol's practices with respect to youth marketing to what used to be the situation with tobacco are actually considerable, much greater than we imagine. And while we were talking earlier about paid product placement, or shall we say, I call it wink and a nod on the golf course product placement, we still have an enormous amount of smoking on TV and in the movies, and I know we're a free nation, but while you don't see brands as often, when you're Marlboro and you have a 50% market share in the United States, you don't really need to show your brand. You just need to convince a kid to smoke, and it's a coin toss whether the money's coming to you or to R.J. Reynolds. So if you watch carefully, you'll see two things. One, the smoking is very much still there. And two, alcohol is on the rise, really on the rise, and on the rise during the day. So you're seeing that it's light out and it's 11 in the morning and people are sitting there drinking on a business day. It's quite interesting and really very disturbing, and it is paid for. Gun placements are paid for, lots of things are paid for. In fact, if you see something on TV, the odds are overwhelming that money changed hands if you can recognize the brand. And then oil. This has already begun. What its fate will be, I don't know. I didn't look at it yesterday, and I know it's a moving target, and I think at this point only 2 states, New York and Massachusetts, remain in that particular litigation. But absolutely, I urge you all to read the LA Times series on Exxon and what Exxon knew, when it knew it, what its position was before it knew it, as it became clear, as it sunk in, and then when they decided to not talk about it anymore. So that is quite a read. And in fact, the scientists who were doing the ocean measurements are here at NYU. One stayed with Exxon and one left and is back here now. So this is an example, and before we play the ad, before you push play, let me just tell a brief anecdote because I'm wrapping up now. This was the first ad that aired in the Truth campaign. It's the short version. I prefer the 1 minute, but for the interest of time, it's a half a 30-second version. I had accepted the CEO-ship and was running Legacy, but I really had not left Columbia University yet. I was in my office, and I got a call from the team that was there with the ad agency about to shoot this particular ad in front of Philip Morris's downtown headquarters in Midtown Manhattan. And they said they're not letting us set up. They said that they're in the process of having our permit pulled and that we have to wait. So as I was speaking to them, another call came into my line, and it was the commissioner, it was actually the deputy commissioner of health for New York City. And the mayor's office had received a call from Philip Morris saying, what's going on? They're on our property. They don't have a right to be on our property. And apparently, the mayor said, I'll call you back. He reached out to the commissioner of health, who in turn reached out to the deputy commissioner and said, call Dr. Hilton and see what's going on. She's the new CEO there. So we explained that we had a permit to be there and that we would very much appreciate it if the mayor did not fold and somehow pick up the phone and call the police department or whatever it would take to then force us to pack up and leave, which I said, if that happens, please film every single second of it relentlessly, because that'll be the next ad. But he said, no, he understood, and he was all for no youth smoking, and so he declined to interfere in any way. He was threatened. Philip Morris said, if you allow this to happen, we're going to leave New York. And allegedly, he said, go right ahead, I'll come help you pack. That's Mayor Giuliani, everyone. And that's 21 years ago. So now we'll see the ad that, thanks to him, actually occurred, even though we have other issues with Mayor Giuliani. And in a moment, we're going to show one more truth ad. But the upshot of that was myself, and I think there are people here from Wilmer Cutler, Wilmer Hale. Myself and many, many lawyers from Wilmer Hale were in the offices of downtown Manhattan of Philip Morris, along with, I think I brought about 12 attorneys. Go and listen to them, and then don't do what they want. So that's essentially what we did. That ad that you just saw was provided to NBC, provided every network that we were paying to have it run. It was very expensive. We spent about $60 million a year on public education at that time, between 60 and 80 million, and that's a lot. I mean, that was the highest spending youth brand in the United States at the time that we were spending. So 95% of young people knew us and appreciated us and so on and so forth. But NBC, and they apologized, so let me say they apologized, they shipped that right over to Philip Morris, which is illegal. I think you guys know that. And so when we came in and sat down, we said, gee, it's like Coke and Pepsi. We gave you our Coke ad and you sent it over to Pepsi. And they said, you're right, we shouldn't have done that, and we apologize from the bottom of our hearts. So they actually got better, and all of them got better, because I would always open up my conversations with them. I don't know if we can get to the next thing, but it's okay if we can't. I would open up my conversations with them by saying, do you have grandchildren? Because they tended to be older guys. And they would say yes, and I would say, you know, we're dedicated to one thing and one thing only. We don't want your grandchildren to ever smoke. And you know, slowly but surely, if you keep coming and you have 14 lawyers with you, eventually, and $80 million, eventually they get a spine, shall we say. So you probably remember from NAG, Philip Morris decided to spend their own $20 million to explain to America that they're the most wonderful company in the world, including, among other things, taking credit for the fact that the MSA was created. And you know, it should be to their credit that all of this happened. So this is the only other ad I'm going to show you. It ran in the Super Bowl. It was a really very, very popular ad because of its focus on consumer protection.
At Shards-O Glass Freeze Pops, we want you to know where we stand on important glass freeze pop issues. For example, we now agree there's no such thing as a safe glass freeze pop. They are addictive and can cause serious health issues. In fact, 1/3 of the people who enjoy our product will eventually die from shards-related ailments. The only proven way to reduce health risks from our glass pops is to not eat them. For more, including information and links on how to help quit our glass freeze pops, visit our website at shardsoglass.com. And remember, Shards of Glass Freeze Pops are for adults only.
So that is one of the approximate 1,000 executions of the Truth Campaign that occurred over my tenure, which went from 1999 to the end of 2013. During that period of time and since, this campaign has won an enormous number of awards, over 400 international awards, including every category award where actual impact has to be demonstrated, and that's scientific, peer-reviewed literature impact. We ran this campaign when Philip Morris commissioned reports for every Eastern European country so that they could explain to their governments why they should not implement evidence-based tobacco policy, increase prices, clean indoor air laws, et cetera, because they would have to spend more for people as seniors from their coffers. So we ran these full-page ads in every major paper in the country, Time, Newsweek, and very shortly thereafter, they apologized. The Truth Campaign, this is just in the first 2 years, it cost $324 million. It saved between 1.9 and 5.4 billion in medical costs. And the most importantly, what's not there is it saved 450 young people from not smoking. That was as of 2004, 4 years into the campaign. It's continued to do so most years. So it's now into the millions of young people that did not start smoking as a result of a very hard-hitting, tough campaign, one that was sufficiently hard and tough that the tobacco industry elected to keep us in court for 7 years to the tune of $17 million in legal fees, much of which we recovered from our insurance company, which was nice. And we ultimately won unanimously in the Delaware Supreme Court, having won in the lower court. And not only did we win, but thanks to Wilmer and Hale and the fine lawyers we worked with, including the late John Payton, the court wrote a little lineup of all the things we had not yet done that we should feel free to do. So that made me really love the law. So I want to thank you all for having me, and thank you for the work you do, and just say that all those deaths we started out with, 33% of the deaths every year in the United States of America, virtually every death there is theoretically 100% preventable. And a big piece of making that happen is having the appropriate interaction between the public health community and the corporate community. So thank you very much.